power ego and a single mistake can cost a life in the operating room. When a hotshot civilian surgeon humiliated and banished a veteran trauma nurse to cover his own fatal error, he thought he'd won. He never expected the base commander to wake up and demand her back. The rhythmic, high-pitched beep of the heart monitor in Operating Room 4 was the only sound cutting through the thick, suffocating tension. At Joint Base Andrews Medical Center, pressure was the default state of existence. But today, the atmosphere was downright toxic. Evelyn Parker stood on the right side of the operating table, her gloved hands slick with blood. At 32, she was a veteran trauma nurse who had spent 2 grueling tours in Afghanistan. She knew the chaotic, unyielding reality of battlefield medicine. She had held the lives of young soldiers in her hands while mortar fire shook the ground beneath her. She possessed a sixth sense for trauma, an intuition forged in the fires of active combat zones. Across the table stood Dr. Harrison Montgomery, the hospital's newest acquisition. Montgomery was a civilian contractor, a brilliant but notoriously arrogant cardiovascular surgeon, headhunted from a prestigious private hospital in Boston. He wore his bespoke tailored scrubs like a tailored Italian suit. Montgomery was brought in to elevate the base's surgical department, a fact he made sure everyone was acutely aware of. He was a man accustomed to pristine operating theaters, compliant staff, and absolute unquestioned authority. On the table between them lay Corporal James Miller, a 22-year-old engineer who had been crushed under a collapsed heavy-duty transport vehicle during a routine training exercise. His pelvis was shattered, and his internal bleeding was massive. "More suction!" Montgomery snapped, his voice muffled by his surgical mask, but dripping with irritation. "And get me another clamp. You people move like molasses." Evelyn complied instantly, maneuvering the suction tube with practiced precision. However, her eyes remained fixed on the ultrasound monitor positioned just above Montgomery's shoulder. Something wasn't right. The pooling blood in the lower abdomen wasn't just coming from the visible arterial tear Montgomery was aggressively trying to isolate. There was a dark, spreading shadow near the spleen, a secondary retroperitoneal bleed that was rapidly expanding. "Doctor," Evelyn said, her tone calm but urgent. "His pressure is dropping, 70/40 and falling. I'm looking at the scan, and there's a secondary hemorrhage near the splenic artery. If we don't pack that quadrant immediately, we're going to lose him to hypovolemic shock before you can tie off that primary bleeder." Montgomery paused, his hands hovering over the open surgical field. He slowly raised his head, fixing his cold gray eyes on Evelyn. The rest of the surgical team, an anesthesiologist, a scrub tech named Brian, and a junior circulating nurse froze. "Nurse Parker, is it?" Montgomery asked, his voice dangerously low. "Yes, doctor," Evelyn replied, not breaking eye contact. "We need to pack it now. The pressure is dropping too fast." "I was unaware," Montgomery said, his tone laced with venomous sarcasm, "that a nursing degree granted you the expertise to interpret a real-time sonogram and dictate surgical procedure to a physician with 20 years of specialized reconstructive experience. Are you the lead surgeon on this case?" "Nurse Parker, no doctor, but in combat trauma." "This isn't a dusty tent in the desert," Montgomery barked, his temper flaring. "This is my operating room. I am isolating the iliac tear. Do not interrupt me again. Suction." Evelyn held her ground. She had seen this exact pattern of internal bleeding before in Kandahar. She knew that if he clamped the iliac artery without addressing the splenic bleed, The sudden change in vascular pressure would cause the spleen to rupture, entirely flooding the abdomen and killing the young corporal in minutes. Dr. Montgomery, with all due respect, if you clamp that now, he will bleed out on this table. Evelyn insisted, her voice rising above the rhythmic alarms of the vital monitors. I am recommending immediate packing. Montgomery's face turned crimson beneath his surgical cap. He threw his bloody forceps onto the metal tray with a loud ringing clatter. How dare you! How absolutely dare you question my medical judgment in the middle of a procedure? He pointed a trembling gloved finger at the operating room doors. Get out. Silence fell over the room, save for the frantic beeping of the corporal's failing heart. Doctor, we don't have time for this, the patient. I said get out! Montgomery roared, his voice echoing off the sterile tile walls. Security, someone call the MPs. I want this insubordinate amateur removed from my OR immediately. I will not have my focus broken by a glorified bedpan changer. The junior nurse nervously reached for the wall phone. Evelyn looked down at the young soldier on the table. Leaving felt like signing his death warrant, but staying would only delay the surgery further, as Montgomery was clearly willing to let the clock run out just to prove his dominance. You're making a mistake, Evelyn said softly. She stripped off her bloody gloves, tossing them into the biohazard bin. As she backed away from the table, she looked at the anesthesiologist, Dr. Robert Sterling. Watch his left quadrant, Bob, please. As Evelyn pushed through the swinging doors of OR 4, the cold air of the hallway hit her flushed face. She leaned against the wall, her heart hammering against her ribs. 2 military police officers arrived minutes later, looking confused, as they were ordered by the circulating nurse to escort Evelyn to the chief of medicine's office. Humiliation burned in Evelyn's chest, but it was quickly overshadowed by a sickening dread. 30 minutes later, while sitting in the administrative waiting area, she saw a code blue team rush down the hall toward OR 4. Corporal Miller had crashed. Montgomery's ego had just cost a young man his life, and Evelyn knew with absolute certainty who the arrogant surgeon was going to blame. By 0800 hours the next morning, the hospital's rumor mill had already convicted Evelyn Parker. Dr. Harrison Montgomery was a master of political maneuvering. Before Corporal Miller's body had even been transferred to the morgue, Montgomery had filed a blistering multi-page incident report. He claimed that Evelyn's hysterical and insubordinate outburst had dangerously distracted the surgical team, directly resulting in the patient's cardiac arrest. Because Montgomery was the hospital's newly minted star surgeon, the administration was desperate to protect his reputation and their own investment. Evelyn sat across from Brenda Wallace, the chief of nursing, and Colonel James Henderson, the hospital administrator. The small office felt like an interrogation room. Evelyn, you know I respect your service, Brenda said, looking genuinely pained as she shuffled the paperwork on her desk. Your record in Afghanistan is exemplary, but you directly countermanded a lead surgeon in the middle of a critical procedure. You embarrassed him in front of the entire staff. I was trying to save the patient's life. Brenda, Evelyn said, keeping her voice remarkably steady, despite the fury boiling inside her. Montgomery missed the secondary hemorrhage. He was tunnel-visioned on the pelvic crush. If you look at the autopsy report, you'll see the spleen ruptured, exactly like I said it would. Dr. Montgomery's report states the rupture was an unavoidable complication of the crush injury, exacerbated by the delay caused by your interference. Colonel Henderson interjected, his tone bureaucratic and cold. Nurse Parker. Dr. Montgomery is threatening to break his contract and leave the facility if you remain on his surgical rotation. We cannot afford to lose him." Evelyn stared at the colonel in disbelief. "So you're going to let a surgeon bury his fatal mistake because he has a shiny resume? He killed that kid, Colonel." "Watch your tone, Lieutenant," Henderson snapped, pulling rank. "Pending a full medical board review, you are stripped of all surgical and trauma duties. You will report to the subterranean logistics wing. You are on inventory and supply management until further notice. Consider yourself lucky you aren't facing a court-martial for insubordination." For the next 3 weeks, Evelyn existed in a state of purgatory. The basement supply depot was a windowless, dusty labyrinth of medical equipment, miles away from the adrenaline and purpose of the trauma bays. She spent her shifts counting boxes of saline organizing intubation kits and checking expiration dates on surgical mesh. Her colleagues upstairs stopped making eye contact with her in the cafeteria. To the rest of the base, she was the rogue nurse who had cracked under pressure and ruined a surgery. Evelyn seriously considered resigning her commission. She drafted her resignation letter dozens of times in her head while staring at rows of sterile bandages. The injustice of it all ate at her, gnawing away the passion she had always held for medicine. But a storm was brewing above ground, one that no amount of ego or hospital politics could control. It happened on a rainy Tuesday afternoon. The sirens across the sprawling military base began to wail a deafening, oscillating pitch that signaled a mass casualty event or a high-value emergency. Down in the basement, Evelyn's two-way radio crackled to life with frantic, overlapping voices. Code red in the trauma bay. All available hands to the ER. Evelyn instinctively dropped her clipboard and grabbed the radio, her heart rate spiking. She listened as the chaotic chatter painted a horrifying picture. A Black Hawk helicopter had suffered a catastrophic mechanical failure during a low-altitude transport drill, crash landing hard on the tarmac. There were multiple casualties, but one name on the radio frequency made Evelyn's blood run cold. "Inbound ETA, 2 minutes. We have Base Commander General William Hayes. Massive blunt force trauma, suspected internal hemorrhaging. Unresponsive at the scene." General William Hayes was a legend in the military community. A grizzled, fiercely respected combat veteran, he was known for leading his troops from the front lines in Fallujah. He was also the man who years ago, in a dusty field hospital in Kandahar, had trusted a young nurse, Evelyn Parker, to keep him alive when his convoy hit an IED. Upstairs, the emergency department was a war zone. When the paramedics wheeled General Hayes through the double doors, the room descended into controlled chaos. The general was pale, his uniform soaked in blood, his breathing ragged and shallow. Dr. Harrison Montgomery strode into the trauma bay, flanked by an entourage of junior doctors. He looked annoyed by the disruption to his afternoon schedule. "All right, clear a path," Montgomery barked, snapping his gloves on. "Let's see what we have. Get him typed and crossed for 6 units, push epi, and get a portable X-ray in here now." As the team swarmed, the General Montgomery began his assessment. "Obvious flail chest, likely pulmonary contusions. I need him prepped for immediate thoracic surgery. We'll open him up, repair the lung, and stabilize the ribs." "Doctor," a young terrified resident stuttered, looking at the monitor. "His heart rhythm, it's highly irregular. He's going into V-fib." "Then charge the paddles, you idiot," Montgomery yelled, grabbing the defibrillator paddles himself. "Clear." The general's body arched off the table, but the monitor continued to emit a frantic, erratic screech. Again clear. Montgomery shocked him a second time. Nothing. The rhythm was wildly chaotic, defying standard advanced cardiac life support protocols. Montgomery was sweating now. The confident, arrogant veneer was cracking. This wasn't a standard civilian heart attack. This was a complex failing system, and the most powerful man on the base was dying under his hands. Standing in the corner of the room, observing the chaos, was Colonel Jonathan Miller, the general's fiercely loyal chief of staff. He had ridden in the ambulance with the general. Miller knew General Hayes's extensive classified medical history, a history that wasn't in the standard digital file Montgomery had casually glanced at. "Dr. Montgomery," Colonel Miller shouted over the noise, "standard defibrillation won't work. He has a specialized experimental biventricular pacemaker implanted near his spine from a shrapnel injury in Iraq. You're overriding the system. You're frying his heart." Montgomery froze the paddles still in his hands. "What that wasn't in his chart. I don't know the frequency to bypass a specialized spinal implant. I need a cardiothoracic electrophysiologist." "We don't have one on base." Brenda Wallace cried out, her hands covered in the general's blood as she applied pressure to a wound. The room ground to a terrifying halt. Montgomery, the brilliant, highly paid savior of the surgical wing, stepped back from the table, his eyes wide with genuine panic. He had no idea what to do. The base commander was slipping away, the monitor's jagged lines flattening out. Suddenly, Colonel Miller lunged forward, grabbing Brenda by the shoulders. "Where is she? Where is Parker?" Brenda blinked, bewildered. "Evelyn, she's in the basement. She was suspended from—" "I don't care what she's suspended from," Miller roared, his voice shaking with desperation. "The general gave me strict standing orders. If he ever went down, if he ever ended up on a table in this hospital, I was to get the nurse who saved his life in Kandahar. She's the only one who knows the exact sequence to bypass his pacemaker manually. Get her up here now, or so help me. God, I will burn this hospital to the ground." Down in the concrete subterranean depths of the medical center supply depot, the harsh, flickering fluorescent lights buzzed overhead like a swarm of angry hornets. Evelyn Parker was in the middle of meticulously logging expiration dates on a towering, shrink-wrapped pallet of intravenous saline bags. The monotony of the task was suffocating, a stark contrast to the adrenaline-fueled environment she was trained for. Suddenly, the heavy industrial wall phone shattered the quiet. It wasn't the standard digital chime of the hospital intercom. It was the abrasive, jarring ring of the red emergency line, a relic from the Cold War era designed to bypass all hospital switchboards during a critical mass casualty event. She snatched the receiver off the wall, her instincts instantly taking over. "Parker," she answered, her voice tight and strictly professional. On the other end of the line, Brenda Wallace, the chief of nursing, was hyperventilating. The background noise was a cacophony of shouting voices and blaring medical alarms. "Evelyn, you need to get to Trauma 1 immediately. Right now. It's General Hayes. He was in a helicopter crash. Montgomery just shocked him with the defibrillator, and the general's specialized pacemaker is shorting out. He's in ventricular fibrillation. Colonel Miller is threatening to have the military police arrest the entire surgical staff if you aren't up here in 60 seconds.